Mother-in-law is only after grabbing her son and she wants the patient and the husband to separate. This is the style of the mother. So you can see the problem with mother, problem with father, problem also with mother-in-law. The patient can't cope up with mother-in-law's energy. So mother-in-law possesses more energy in comparison to our young patient. So you have to see again energy variation. She escapes from constant conflict and often stays at her mother's place. So what is the best solution? No? Instead of increasing the capacities to deal with the situation, it is a kind of escapism. Mother-in-law constantly abuses, curses and humiliates the patient. This is the life. Husband is bursting out type, he always gives an impression as if something serious and irreparable has happened. So what is the husband's mental makeup? Everything is very serious. Something great has happened, some earthquake has happened, some fire has occurred. And there is always a kind of an emergency. He has the habit to blame others and this is very upsetting for the patient. Painful events in the past. After the first delivery, when she was at the mother's place, she was in need of the money for the delivery and the hospital expenses, but mother-in-law refused. And at that time, patient had no money and she was not doing any job. Patient developed preeclampsia with hypertension, convulsions, emergency C-section. The baby was premature, incubator. She was constantly crying, and she developed depression and terror of death of the baby. See how the psychopathology case developed. When the coping up mechanism is poor and something circumstantial stress is very influential. So something comes from the inside, no? When the person is sick and the harmony is lost. So this is real you, no? Which comes out. And then it is expressed on the screen. Once both children were sick, elder daughter had pneumonia and second baby bloody diarrhea. Mother-in-law didn't help. She was depressed during this period. Her skin symptoms worsened. She took steroids and antihistaminic with little benefit. Elder daughter once confessed that she is bisexual. This was a big shock for the patient. Now the problem with the daughter. Daughter quarreled, refused to stop her relations and left the home. So now focus is on daughters. One daughter has gone now. Are you able to see now how the stress is now crystallizing in childhood? The patient felt very bad, humiliated and very bad skin developed. So the atopic dermatitis worsened. The daughter after few months came back for the delivery and the patient took care of her and the daughter had a normal delivery of a female baby. So the patient as a mother did her job very diligently. She could have told the daughter that I will not go look after you, I will not do anything, but she obediently followed her mothership. However, after 1 month she left the home and now doesn't keep contact with the patient. So she was being exploited by the doctor. Are you able to see now how the atmosphere is available in childhood? Last year she realized that her parents were seriously ill and her skin deteriorated. Patient's parents are ill because of the old age. Intense burning, itching and she had to take steroids. The parents are still sick and she is concerned about them and help them. So she is a lady who is concerned with everyone. She will nurture everyone, she will give her love and respect to everyone. But in return, she gets only humiliation, exploitation. And this is going on in childhood. The atopic dermatitis has caused disfigurement of the face, scarring, and dark discoloration, and she feels embarrassed to go into society and avoids social functions. So family disturbance, social disturbance, and her work is poor. So how she will be able to gather her pleasure? Her confidence is zero at present and feels neglected and isolated. Weeping, worse when sad, when conflicts are there, brooding is for 3 months, dreams of daughter being kidnapped. Are you able to see now? What are the dreams? Dreams of daughter. Which daughter? The second daughter. So how the anxiety is now coming at the level of the second daughter.